everyone else come in the meantime, I want to take this opportunity to welcome everyone to, in my opinion, and I have to say this from the bottom of my heart, I've never been in such an exciting company at an exciting time with exciting people that actually contributed. And that includes, of course, Dr. Prasad, who's the foundation really of every reason why we're here. But also it took a company to put this together. So I love the company. But especially over the last 8-9 months that I've been here, we have been hearing experiences that are absolutely incredible. It's been said that facts tell why stories sell. Facts tell why stories sell. And there's a lot of truth to that. With me, I came into this company not based upon opportunities or anything. I came in because I came across a product that actually worked. In fact, it's kind of funny, here in South Africa, I came across a few people that had been on Engaged Global Products for a while. And Dr. Prasad, I have to tell you this, I didn't know that. As I showed these products, some of the people started saying, hey, I got that product and I'm using it and it's absolutely incredible. I said, man, not even in South Africa. They said, yes, you are, but they're bringing it here personally. So obviously the word is starting to get around thanks to everybody on here. So we're not just on here with a facade or something that we just imagine taking place. This company, this product, and everything we're doing is actually changing people's lives. And Dr. Prasad, as well as our CEO, has said that their goal is to take this to the world. And so tonight, you're going to hear some incredible facts and stories that's going to help you to appreciate that this is the right company, it's the right product, it's the right it's just the right everything as far as to make a person in this crucial time of health to go from a so-so health to a wonderful health. And so tonight you're going to hear some facts. If you have not called your friends and family to come on this call, I suggest you do so. So what's the next call going to be about? It said, and I want to read what Jonathan wrote because I think this is important. He said, did you know that every cell in the human body has CBD receptors? What does that mean? Well, Dr. Prasad, I just took my CBD. The problem with taking my CBD is, of course, my pain goes away, my anxiety goes away, but also I feel my body getting ready for a good night's sleep. And we're going to hear a little bit about that tonight. So tonight, we're going to be with Jonathan and Dr. Prasad as they attempt to extract details about the role the CBD from hemp plays when it comes to wellness. So the theme tonight is CBD, Pathway to Better Health. I suggest, by the way, if you don't have your pens and paper, you need to get your, whatever it takes to record everything. You're going to hear information about CBD that's going to blow you away. And we're different from anything you find in pharmaceutical. So let's give our attention for the next hour to Jonathan Jones and Dr. Kedar Prasad as they enlighten us as to the benefits of Engaged Global CBD and what makes us different from anything out there. Jonathan, come on. We're going to turn this over to you. Jonathan, you're muted, and none of us read lips.
Now, Bernard, I don't know. You got some serious ability that you've acquired over the years. No, not over the years. The only time you've acquired these abilities is since you started taking brain boosts. All of a sudden, you've had these abilities that just come out of nowhere. You're like a different man now.
and you know what's funny? Is the best is yet to come.
That's it. That's
Back
it.
to you and Dr. Kedar Prasad. Welcome.
Well, thank you. Thank you very much. And certainly appreciate your always setting things up for us and the sacrifice that you make all the way from Johannesburg, South Africa.
Yeah.
Joining us. We're excited to have you here with us. Here's what we'd like to do is, and by the way, as Bernard said, my name is Jonathan Jones. It is a pleasure and a privilege to be involved in a program like this on Sundays, to have any kind of connection with the formulator of the products, Micro Daily, formerly known as MMF, is truly a privilege and an honor to be able to do that. And I'm excited to be able to extract from Dr. Prasad information about anything that he'd like to share with us. And we're seeing some amazing things happen as far as micronutrients are concerned. And I'm hoping that we can share some of the information with you. Now, we have a number of co-hosts with us. You know, besides Bernard, we've got Jeff Ashby, Freddie's a co-host, Alfreda's a co-host. We have several co-hosts that join us and help support us with things, with meetings like this. And quite often, Jeff has a testimonial that he wants to share with us. And so we're going to be calling on Jeff to pull one of those tricks from up his sleeve, like he always does. Because we had a number of folks that had some really interesting results with CBD, but there are other things that I also want to do, because I wanted to ask Dr. Prasad to tell us a little bit again about what happened here with this one person, Kareen. She was telling a story about her mom that for me was just absolutely amazing, and I really want to get Dr. Prasad's comments on it before we or shift over and start talking about anything else. So let's do that. So,
want to do disclaimer?
Yeah, I'm about to share the disclaimer right now with everyone. So keep in mind, folks, that as we have meetings like this, please remember that when you hear testimonials are purely anecdotal. What happens to one person may or may not happen to you. The FDA has not evaluated these comments. What you're hearing is for information and educational purposes only. Engage Global, Dr. Prasad, host, co-host, none of us are making any claims that Engage Global products will treat or cure or heal any disease. That's not what this is all about. So these products are really just for our the nutritional supplements, because only the government can declare something to be a treatment or cure for disease. So we're not saying that at all. So please understand that. This is for information and educational purposes only. We strongly recommend that you seek the competent medical advice of professionals that you trust. So let's get Dr. Prasad. Let's listen to this, this statements, these comments by Kareen about what happened to her mom. And Dr. Prasad has heard this before, but there are some of you here now who've never heard this. So let's just listen in here for a second. All right, hang on one second, folks. Let's see if we can't share this screen and share the sound. All right. So you see the disclaimer that I basically paraphrased and related to you there right on the screen. I hope it comes up on your screen. Okay. Yeah, I see it full screen now.
John, I think you have to put the voice on.
I've been running like 115. Now, since I start using it, it's been like 88. Went to the hospital Friday morning. Congestive heart failure. She's also diabetic, and she has chronic kidney stage 4. So she has all this fluid on her. They put her in MSICU, and she's been having a lot of problems. I was scared to death as a nurse, thinking I'm going to lose my mom. Difficulty breathing, her lungs filled with fluid and all that. Anyway, I said, I want to try it. I want to try it on her. But then I'm like, oh my God, should I not? So I went to the hospital and I mixed 4 capsules of the Micro Daily in the applesauce, and I gave it to her yesterday morning. Now, she wasn't peeing. They're thinking dialysis because her kidney functions are way, way off. I'm like, oh my God, I can't give her dialysis. Now, they had put a Foley in her because they want to see if the urine output was coming. They're like, we don't see urine. Maybe she's retaining. Now, within 5 hours, that urine, that bag had 800 liters of urine in it. I kid you not.
Wow.
Now, I wanted then, her hemoglobin was a bit low. So the nurse said, is she anemic? Yeah, she is. So they said, and they kind of tugged the Foley a little bit. So there was a little bit of blood. So they did a hemoglobin to see what her blood count was. With the bleeding, her blood count should be lower. Her blood count went up by 2 points. My mom, she's been sleeping ever since I put her in the hospital, sleeping. She would open her eyes and go right back into a deep sleep. When I went back to her yesterday, she was up singing. All last night, she was peeing like rain, all right, in the Foley catheter. I went back this morning because she's in MSICU now. And they're saying, hey, they're asking me, is she full code? Yes, she's full code, all right? I went back this morning and I gave her another dose. The cardiologist, they called me and they said she might go home Tuesday. So the nurse, they did a urine culture. They were like, oh, we gave her some antibiotic just to make sure. But she just turned around, a full U-turn back to okay. So we think it's a dose of antibiotic that did it. But I did not tell them what I did because I wasn't supposed to do it. And I'm a nurse and I work at that hospital. So I couldn't tell them. But oh my God. I just had to say it. I am driving now to go give her another dose. And I just had to say it because I tried it so I could introduce it to my patient. But when I see what it did to my mom that I thought I was going to lose, I'm like, oh my God. Her kidney function, her BUN and creatinine started going up to the normal level. It's not there yet. It's going up, going in the right direction. Her blood glucose, because when they check it, it was 244. When they check it, it was 118. Oh my God.
How old is your mom, Karen?
87.
Wow.
87. And now, nice clear urine coming out. That wasn't coming before. They were setting up dialysis for her. It was the microdaily that did it.
Which formula did you give your mom? EMF or original?
The red label.
And you gave her
four. I gave her 4. Yes, I am a nurse. I'm almost a nurse practitioner. And I was a bit hesitant to give it to her. But I'm like, you know what? They're telling me my mom is doing very bad. I'm just going to take my chances. I knew what it was doing for me, but I was a bit, especially with her age, and she has a lot of stuff going on. Congestive heart failure, diabetes, hypertension. She had a heart attack before. She had a stroke before. A whole lot. And oh my God. Whew, okay. I just had to say that.
No, we're glad that we're glad you felt like you had to say that. This is the food that's missing from food. People will say, my doctor said don't take anything. Did your doctor tell you to stop eating? If the doctor said don't eat, then yeah, don't take it. This is simply the food that's missing from food. You're putting it back in someone's body that you love, care for. So that's my viewpoint of it. Okay? Because
I called my friend Andrea. I'm like, Andrea, I just want it hurts bad. I want to give it to her because Andrea's a nurse also. And she said, Kareen, only help her. It can't hurt her. I'm like, you know what? Let me just give it to her. My mom is up talking. She was even dancing in the bed. She sang an entire hymn to me that she couldn't do before because of the fluid in her lung. And her leg, you would push it and your finger would sink all the way down. Her legs, they're not totally there yet. Much better. Much better.
Your story will undoubtedly help a lot of people.
Yes.
Okay, good. So, Kareen, let's go ahead and hear your comments because we played the recording of your story when we first got started. So, go ahead and give us any updates and share with us whatever you'd like to share with us now.
Yeah. Hi. How are you?
Very good.
My mom is not with me right now. She's still in the hospital, but will be home tomorrow. Thank God for that. However, I wanted to tell Dr. Prasad that last week, it just took a week. This whole thing was within a week. Her let me pull her labs up. Her EGFR, it was 16. And they said if you go to 15, then dialysis because she had a whole lot of fluid in her lungs. Her saturation, oxygen saturation was like 72 and all that. So she had to be on oxygen. That's how much fluid she had in her lungs. But this morning and actually I ran out of my microdaily. So I was giving her 4, then I went down to 3, then 2. I just had to stretch it and I'm waiting for my shipment. But this morning, her EGFR at, 9:34 a.m. was 35.9.
Wow. That's amazing.
35.9, yes. And hold on. And her creatinine that was 2.9.
Wow.
This morning at 9:34 is 1.42. And her BUN that was either 61 or 62. This morning at 9:34 a.m. is 30.0.
That's amazing. That's amazing.
Yes.
Do you have, Karen, any data on this?
Oh yes, I have. I took pictures of all. Yes,
C-reactive
I will get
protein.
the labs printed. Yes, I have all that.
Yeah, I like to see the lab printed. That will be very interesting.
Yes, I have
You can
that.
email me.
But they do not know. I didn't tell them what I did. They're still wondering, they were asking, because I have a caregiver sitting with her, and they're asking, what have you been giving her? Because she just bounced right
You tell her
around.
what you were giving.
Exactly. They're like, what have you been giving her? She's like, nothing, just food. So my mom, and she told me this, she's not on oxygen anymore. Her edema is totally gone. She's peeing nicely. She says, I'm ready to go home. Nothing is wrong with me. I want to go home. She couldn't even stand. Now she's walking to the bathroom.
See, Jonathan, this because of the she's having a lower A1C probably, and therefore oxygenation level increases. Otherwise, oxygen was not getting there.
That's right. That's
exactly. Right, exactly. And now they had put her, they're not giving her, she was on Januvia and all that. They have her on a sliding scale for insulin, but they hadn't given her because her blood sugar been running real good. I mean, everything is just in the right direction. The nephrologist came this morning. I'm like, oh my God. And honestly, I must tell you, that's the best I have seen her kidney functions in about 5 years. So basically, she went from a stage 4 down to like a stage 2 right now.
That's very good. Good progress.
Okay, so we're gonna stop right there and talk about this for just a couple of minutes. But before bringing Dr. Prasad on, because I mean that's to me one of the most amazing stories that I have heard since I've been connected with this company, to see someone transition from as the nurse, the daughter says, stage 4 to stage 2 kidney disease. It's just remarkable, and that's her version of the story. That's not the woman's doctor's version of the story. That's Kareen's daughter. I mean, Kareen is the nurse whose mother had the experience. But let me just properly introduce Dr. Prasad to our discussion. Dr. Prasad was a professor at the University of Colorado School of Medicine for 30 years, director of vitamin and cancer research. He was also the former president of the International Society of Cancer and Nutrition. Dr. Prasad was a member of the British Society of Medicine and also a Nobel Peace Prize nominating committee for the candidates of medicine. And really, seriously, we could pretty much just say that by itself, and that would be enough to introduce this amazing gentleman to this discussion. But there's more. He was also the world's first radiation biology PhD. His products have been awarded 7 U.S. patents on micronutrients, and there are a number of patent pendings right now as we speak. So at the young age of 88, the man is still working and still cranking out new stuff. He discovered the anti-cancer potency of vitamin E succinate. He also discovered that butyric acid, the small fatty acid formed by the fermentation of fibers in the gut, is an anti-cancer agent. My question to you before we go forward with this is, if you had your choice of being able to put a probiotic in your body that's just a probiotic versus one that's been formulated by the gentleman who discovered anti-cancer components of probiotics, one particular one, which one would you choose? I think I want the one that can handle some business while it's doing its job there. But Dr. Prasad was also the author or co-author of some 32 books. He's working on his 33rd right now. It wouldn't surprise me that if he does not start right away on a 34th one, as soon as he's done with this one on diabetes. But he's also been published more than 250 times. I think the number's a lot higher than that at this point, but that's what we have officially in writing as of now. So it's my pleasure, my privilege to be able to introduce to our discussion now and invite into our discussion Dr. Kedar Prasad. So Dr. Prasad, thank you for joining us and welcome once again to our discussion.
Thank you, Jonathan. And it has been always my pleasure to talk to you and to your colleague and all the participants of this meeting. I appreciated that, and I will contribute whatever I can, and people can ask questions, you or people, and then I will try to answer if I can.
All right. Well, then that's what we're going to do. We're going to take some time to go right down that road and see what it is that you can share with us with regard to some of these amazing things. So let's talk first about this Kareen and her mom.
Kareen. Yeah.
Now, what did you see there, Dr. Prasad? Tell us what you saw in that whole account that she related.
Yeah, it is amazing that even in such an advanced stage, it can reverse certain things. And if you look at the biology, what it happens, she was going through one of the diabetic-related complications, and damage to the kidney is one of the major one. And then you can ask question why it happens, why diabetes happen, and why diabetic-related complication like kidney damage occurs.
Right.
And I have written in the book, most recent one, that it really increased oxidative stress and chronic inflammation. And in her case, it mostly looks like the chronic inflammation was so acute. And as you know, when you have a high level of chronic inflammation, they produce a lot of cytokines. And that can cause organ failure, kidney failure in this case, and probably some other organ failure like heart and everything, but she was suffering from. So from science point of view, and what happens to these patients if you don't do it, if you have micronutrient deficiency, create all these kind of issues that you saw it, including the diabetes. And so when she was taking a micro daily EMF and put right there in her mouth through the applesauce, that got quickly absorbed. And when it got quickly absorbed, then oxidative stress and inflammation started going down. And when it goes down, your cytokine storm doesn't happen. In a way, she was going through a cytokine storms because it was damaging everything, just like in COVID-19, And so when this happens, you ended up in organ failure. And kidney is one of the systems. So when it happens, then we know that it reduces inflammation and reduces cytokine storms type of production because she was such an advanced stage. But calming down those reactions, not 100% quickly, but calming down, she started reversing back towards the healthy lifestyle. And so I'm surprised that it was as late as that one.
Right.
But if you know what happens during that period, then you say, theoretically, this is probably expected. But theoretically you expect, but in practice, it never happens.
Right.
See what I mean? It
seldom
happens.
Yep. Well, tell me this, Dr. Prasad, because you said cytokine storm. Now, normally we think in terms of cytokine storm as it relates to the lungs.
Yeah.
But cytokine storm can actually affect any part of the body?
Part of the body, yeah, exactly. Not only lung, it can start because once the immune system has started producing to fight all this kind of infection, or in this case, high oxidative stress damage. Damage is kind of like infective agent also damages, and oxidative stress also damages. When anytime cell damage, then your immune system sends to repair it. And if they can't repair it, they start still producing cytokines, and then it accumulates, and then you have all hell loose.
Gotcha. So then oxidative stress is the real problem.
Yes, yes.
So why would it start? And my other question with you on that is, if her body was oxygen deprived, which it sounds like it clearly was because of like you said on recording, her blood cells were not able to, they were coated with glucose, so the oxygen carrying capacity of the blood cells low. Yeah. Why would it start to show up in the kidneys first versus, say, the heart? Or is that just
kidney? Because that was at this time because of the all cytokines damage. It is not an oxygenation issue. It was also cytokine damage. And and that is happening not only in the kidney, but it was also affecting my heart and the whole body system. And the kidney becomes, because of the in the earlier stage, the later stage of diabetes, your kidney was very much getting damaged.
That's
And
right.
not only kidney, I could have been damaged, could have
That's
been,
right.
sometimes it is selective, is for certain individuals. You can't explain why complication occurs for some people more in the kidney, some people have more in eye, some people have more in peripheral neuropathy. It is just a chance. But in all those states, same phenomena is involved.
I got you. So really the kidney was just the worst and a manifestation of many things. The entire body was really in distress.
Right.
But the kidney was just the biggest problem at the
biggest
time.
And as he said, the EGFR, which gives the capacity to filter kidney, they were damaged. So now even glucose, what is being produced, they can be removed from the urine. And so it was amazing that she can reverse it. This is so exciting. All these mechanisms, but disease really does it. Yeah. And in this case, looks like a micro-DLEF is known to reduce oxidative stress and inflammation. But I never thought that in that later stage, still it can do some good.
Reverse to that degree. Here's a question that maybe is on the mind of a lot of people. Why is it that your formula has such a huge impact when people have been taking vitamins for years? Yeah, and there's some people who even you go to the hospital and they'll put IV drip of vitamins in a person, and it never has this effect. Why is it your formula doing that, Dr. Prasad?
Yeah, I think that's a very good question, Jonathan. If you look at the other formulations, first, sometimes they just have a vitamin antioxidant that we take from the diet. They don't have the antioxidant that our body makes it, like glutathione, coenzyme Q10, and acetylcysteine, even though our body does make an acetylcysteine, but that is very important to increase the glutathione level. So our is like it's a CQF standard that nobody can claim that, right. Because it is a right combinations. For example, most of the industry thinks that vitamin A and beta carotene have same effect. Right. It's not true. Even though beta carotene is a precursor of vitamin A, this has been known for 100 years, but and one molecule of beta carotene will produce 2 molecules of vitamin A. This has been known forever. Right. But recent data suggests that some function that beta carotene can do it, vitamin A cannot do it. And some function that vitamin A can do it in the cell, that then beta carotene cannot do it. And one example I'll give you. When normal cells become cancerous, normal cells are joined together by a protein called connection protein. When cell becomes cancerous, that is get lost. And so now they are started dividing abnormally. When you treat the same cell, cancer cell, with beta carotene alone, they induce this connection protein. So now they become like a normal cell. Vitamin A cannot do it.
Oh, wow.
It cannot do it. And for example, vitamin A during development, they play an important role in differentiation of your muscle cell, bone cell, brain cell, and so on. But beta carotene cannot do it. And so many times you will see commercial preparation, they will say vitamin A from beta carotene, as if the only function of beta carotene is to make vitamin A.
Vitamin A, yeah.
You see what I mean?
Yeah.
So we have treated them as a separate ingredient, vitamin A and beta carotene. This is very important to remember. And then sometimes, most of the time, people use a vitamin E acetate.
Yeah.
Vitamin E, clinically. But after I discovered vitamin E succinate, I said, this is more important than vitamin E acetate. And vitamin E acetate is one major difference is that vitamin A acetate cannot cross easily blood-brain barrier. So your vitamin E level in brain doesn't go very high. And this has been shown to be true in a clinical study. But when you have vitamin E succinate, which is much more soluble than vitamin A, and therefore it can cross blood-brain easily and go into the brain. And then they get converted to vitamin E there. Plus, vitamin E succinate has some unique function, like you mentioned, that it acts as an anti-cancer agent that none of the other forms of vitamin E can do that. So vitamin E succinate has some unique, some also improves the vitamin E level, and some have unique function. That's why in our preparation, we have both vitamin E acetate, and because they can take care of peripheral issue, and vitamin E succinate, which also can increase. No other vitamin preparation has this thing. So I can go forever to explain this. And also the very important is the dose. Dose has to be safe. But now also not only it is safe, but it is also effective. And we have shown in a clinical study on human that this is safe as well as effective. No other, they can claim it. They may say in commercial market, this is the best formula, but nobody has done a human study. And our formulation has done not only human study, but many more, the animal study, radiation protection, and,
Right.
It's amazing.
Right. Okay. So no question about it then. That's just 2-3 examples of why.
I can give you 10 examples, but this is just
this formula is unique. So anyone who's listening here right now, I don't care what they think or what they say. It doesn't matter what they see on the label. This is a very unique formula. It doesn't make sense to me that other scientists don't mimic this. I don't get that, Dr. Prasad. That doesn't make any sense to me. But since Bernard said that we're going to be talking a little bit about CBD, let's touch on CBD here for just a minute and come back to this, because there's a number of folks that got a few questions. Freddie, are you with us right now? Or Sharon? Let's see if Freddie's is here. She's one of our co-hosts right now. And both Freddie and Sharon actually had Sharon Witherspoon had very interesting results. Using CBD for some serious depression issues. But while Freddie's coming back on board, could you go ahead and just give us a brief understanding as to what CBD is and why it is that everyone should consider adding that to their supplement protocol?
Yeah, CBD is called cannabinoid, cannabidiol, and as you know, it was discovered while they were working on marijuana plant, and they wanted to know why the brain gets addicted to, or they are having a fun. Some people have it, and while doing so, they found out there is another protective system in our body called endocannabinoid system, and so that is totally different story. But it is important to know that endocannabinoid system is very important, and it has a receptor-mediated action. And I will tell you how CBD is effective. And so the question is, for anything...
This CBD we're talking about now, though, is not from marijuana, though, it's from hemp, though, right?
No, hemp plant, And the reason we have a hemp plant, our product is from hemp plant, because marijuana plant has a 20% THC, which is, as you know, very addictive.
So you're not trying to get people high. Okay. You're trying to get them healthy, not high.
And as well as addictive. But hemp plant has only 0.3% of THC.
That's almost nothing.
Almost. And we further purified. Our company has made a special trip. I think David did it, and make sure it is highly purified. And there is not even a trace of THC there, and it is not addictive. And the isolated from hemp plant is now CBD approved by the FDA to be given to children. And do you know the dose? They have used these children in a dose, and they are considered safe, between 600 milligram to 1,500 milligram per day.
Oh my goodness, that's like a whole bottle every day.
So, but I'm saying that we are not recommending, but I'm saying that this is completely safe. Non-addictive. So normally the worst thing could happen is that you don't feel any difference, and best thing could be happen that I will tell you why. Shall I tell why, or you will have the other guy first? Okay.
Let's do the why real quick here, and Freddie will let us know when she comes on. But go ahead.
Here is how it helps. First, CBD action, beneficial action, is mediated by endocannabinoid system. And when you say endocannabinoid, there are two ligands. It's called anandamide. In Sanskrit, it is called a bliss molecule. It's very interesting. So CBD increases that molecule. And that when that molecule increases, then you have a CBD receptor. And R1, R2, in the brain, you have R1, R2 is in the peripheral immune system.
Wow.
And so this is very important. So CBD works first indirectly through the receptor-mediated action. And the second is it also acts a non-receptor-mediated action. And I will give you some example. For example, its receptor-mediated action is that it can block the release of glutamate, which causes hyperactivity, which causes also anxiety, depression, and also it blocks the release of the inhibitory molecule like GABA, GABA-aminobutyric acid, and which calms you down so that you don't get very excited. And actually, GABA is recommended. Prescription drug is GABA, GABA-aminobutyric acid, and so they mediate through the receptor mechanism. But also, in addition to that, the CBD also acts as an inhibitor of reuptake of serotonin, because when serotonin becomes reuptake by the cell, they get metabolized.
Oh,
so prevent the reuptake. So in this way, it is the serotonin level in the brain is elevated. Not only that, but it also stimulates directly serotonin receptor. So you have a double so that serotonin can be high. So what is the result of serotonin high? You get calm and quiet. No anxiety, no depression, no sleep. So it is very important, serotonin. And so not only you have a not glutamate, and also that because if not released, the glutamate, as you know, is very toxic to nerve cells. So it is very important to prevent the release. Not only that, they also, if you release excessive amount, they also cause hyperactivity. You are hyperactive. So, for example, in ADHD or autism, glutamate is excessive amount released.
Wow.
And so it is important. Certain antioxidant we do some, and that's why I'll always say take micro daily plus CBD. We always do that. And another thing this the GABA does directly, it acts as a dopamine receptor agonist. And as you know, when your brain has high level of dopamine, you feel very happy about it. So not only it calms you down, but also makes you happy and relaxed. And that's very important.
So if I really want to literally, in a way, take a chill pill without having all the negative stuff, then CBD is a very good thing. So
CBD, if somebody said that what I can do it if I have anxiety, I will say I don't have anxiety because I take all these things. But if somebody asks me that, can you suggest something? Well, I said, well, I don't know, but here is the micro daily EMF, probiotics, collagen peptides, and take for your good health, CBD. Those four. And then depending upon your need, your brain or eye or something, you take additional one. But at least this one is a must.
I 100% agree. I 100% agree, because sleeping at night is critically important. We have one story lined up. You shared her story before, and Freddie, if you're here, let's bring you up to the front and just tell us, what benefits you got from CBD. We got the detailed version of it at one time, which I think was just really great. But give us an abbreviated version of it, so because we got a few questions that we need to try to address as well.
Sure.
So, but go ahead, Freddie. Can we get Freddie to unmute?
Mute. Can you hear me? Can you hear me?
Yes, we got you now. We're getting a little.
Sorry about that. I had two devices on because I was in and out.
Okay.
Yeah, sorry about that. I could hear you, but I just couldn't get to the computer that fast. But
no
yeah. So I have one of those kind of extreme cases, I think it is, because I haven't met a lot of people like me. I have the crippling type of depression and anxiety. I mean, I know all of it is, but so it's been about 30, 40 years that I've suffered from anxiety and depression. My first diagnosis was chronic major depression, because I stayed depressed. It felt like my brain was wrapped in cellophane for about 15, 17 years. So I just couldn't function very well. And I've been through therapy, been suicidal at times, to the point where I had to be hospitalized. And so lately, when I got sick back here, because that was about the only thing that I had trouble with, which was major. But other than that, a lot of health problems I didn't have. But when I started having trouble where I couldn't breathe and all that kind of stuff with my heart, my anxiety level just got really bad. It's like I stayed upset about everything and anything. And it's one of those things you can't control. Sometimes I see people now on the TikTok and they just lose it. They screaming and how. I understand now. I understand that's not just anger. That's anxiety. Like, so I wasn't a bad person. I thought I was a horrible bad person. That contributed to my depression, because I couldn't control this anxiety. Nervous, like I wouldn't have been able to do this. I would shake so bad. You can see I'm shaking a little bit now, but I just took my CBD, so I'm cool. But the first thing I noticed too, after my breathing improved, was that I was much calmer and I was sleeping better. And that was just on the EMF. But then when I started on the CBD, it really just calms me down. I have been in several situations, I would say in the last 3 or 4 months, that would literally put me in the bed. So I would go to bed for weeks.
Oh,
like weeks. I would just be in the bed. And at one point I was in the bed for a whole year. I just couldn't function, right? I know a lot of people on here, but it is what it is. I used to crawl in closets. It was so bad that I had to make my world really small so I could function. And I feel like I miss my kids, growing up a lot, because I wasn't able to function as a mother. I remember reaching out of the bed and put my baby's hair in a ponytail and send her to school, and her kindergarten teacher would comb my hair every day. So it was really bad. But I started taking the CBD and I'm much calmer. I can deal with, it might put me in the bed for a day now, it depends on what it is, but it's just a day, it's not weeks.
Wow.
I've learned how to cope better. And I remember you saying something, Dr. Prasad, about this anxiety. I don't know if you said it produced a lot of free radicals or antioxidants or something like that affects the body. And so whenever I remember you saying that. So whenever I feel this anxiety, I say to myself, you're creating free radicals. You're creating free radicals. You got to calm down. You got to do something with it. Dr. Prasad said, that's not good. And so I'll grab my CBD or my EMF I keep it all. I got it all. I take it all day. And my life is just different. I'm still working on getting out of the house. I have gone out in the garden, but I have a special occasion coming up this week. Like that's my goal, to be out, to get out and go to that. So I'm going to have a lot of CBD with me when I do that. But yes, it anybody that has the kind of anxiety I'm talking about, or even if it's not this as bad, I've had a lot of bad things happen through my life since childhood. So, the doctor told me that my brain was actually like it had been in a car accident. And so, and my diagnosis is, you hear people on bipolar. Well, I think I'm bipolar 1. Can't remember. But anyway, I stay on low. So a lot of people with bipolar, they go high. The people you see screaming at the Walmarts and stuff, that's probably bipolar the more popular one. I'm that person you don't see. I might disappear for weeks. Like people say, well, where you happen? You know, so yeah. Thank you for the CBD. It is an excellent product.
How long she has been taking?
Oh, I started taking the CBD in probably not until November.
Okay.
I think I started taking it.
Wow.
How much you take it?
I sleep better. Well, at first I was taking like 5-6 a day.
Mm-hmm.
More, maybe more.
Mm-hmm.
And it doesn't make me feel like I'm high. It just
it is non-addictive. So like you said,
I
it
don't
is
feel
very
any of that.
non-toxic. You can't go wrong.
Exactly. So I was taking maybe 5-6 a day, maybe more.
Yeah.
Because I might
still, the doses from the doses up to 600 to 1500 milligram are considered safe. So there is no toxicity, at least up to 100 or 200 milligram per day. There is no toxicity.
Wow. Wow.
So now I take at least 2 a day, or if I'm getting ready to do this, I pop an extra one. Maybe an extra.
Okay. That's all right. As long as you're feeling great, I'm glad to know that you are doing so well. Thank you.
Thank you.
Thank you very much, Freddie. So, Dr. Prasad, does that confirm your?
Yes, yeah, because you can see that how happy she is, and also, as a matter of fact, the serotonin reuptake inhibitor is also a prescription drug. And but that has toxicity too. So commonly, like PTSD, for example, they also have the same symptoms. They have depression, anxiety, and one of the medications that they recommend when I was doing collaboration with PTSD people in Los Angeles, and they said this is one of the medications commonly recommended. And at that time, I didn't know much about CBD.
Wow, and we've got this one, and we've got microdaily, all with no toxic side effects. That's just a beautiful thing, folks.
And also that it has no adverse interaction with the drug that you may be taking.
Yeah.
That is diabetic drug or anxiety drug or anything that, medication, it does not interfere. As a matter of fact, it might potentially reduce the potential toxicity of prescription drug and might improve their effectiveness for a longer period of time.
That's beautiful. That's beautiful. A lot to think about there, folks. So here's a couple of questions that have popped up, Dr. Prasad.
Sure.
Becky wants to know, what products should a college or pro football player take?
College and football player, I think for them, I think it should be very important to take of course, microdaily EMF and brain boost. 2, they must take it because they are college, so they don't at that moment their digestive system and probiotic system is not abnormal because they are young kid. And therefore, at least 2 medications that I would recommend is a brain boost and the EMF, microdaily EMF. They should take it before going to the play, and when they come home after the play, say for example, or even while they are doing a practice, training program, then after that. But especially during playtime, see, they must take, say, an hour before they going to the field. And when they came home, then take another dose, routine doses in the morning and the evening. But in the playtime,
take the extra.
Playing it, the day they are playing it, then you take before, an hour before, and when they go home after playing, then take another dose.
Yeah.
And the reason is because when they are using a lot of oxygen, you are generating a lot of free radicals. And most of the free radicals are very short-lived. But some free radicals are also long-lived. They live for 5 hours. You also want to take care of that.
That makes perfect sense. Very good. Someone is asking a bunch of questions about new products that are coming down the pipeline. We're going to let Jeff comment on the new products coming down the pipeline because he might have some inside information for us on that. Mary asked the question that you just answered. Can you take this product with other medications? And you just made that clear that
Yes.
there's no contraindications at all.
Yeah.
Right. And the other question was, no, that's about the omega. That's down the road. And no.
In July, I think last time we had a meeting in the morning, with Dr. Picola. I think he mentioned that he's going to market omega-3 fatty acid in June or July. And the formulation is already done and everything. And that will be really another, just like a CBD, that will be another thing that can improve your memory loss issue, especially. And because sometimes we have a memory loss, but it is not dementia. Sometimes people diagnosed age-related memory loss that, you might have dementia. No, this is not true. Dementia is totally distinction. And that the new MIC that I started writing on dementia, I have made a very good distinction between age-related memory loss and dementia. Very different things. Biology is different, brain changes differently. And so wait for one, but especially omega-3 fatty acid would be another, just like a CBD.
Right.
If this kind of issue, if you're feeling like this, then you take that.
Right. Very good. Very good. Looking forward to that because
also improve your immune function. All these medication does certain things, but they do it different pathway. That's important. So you can get a maximum benefit.
Right. Right. Okay. Very good. Very good. Well, looking forward to that one also.
Maybe Jeff can explain more on this issue than I can.
Oh yeah, he'll comment on that probably just as we are about to wrap up. Cynthia asked a question. This is something that's come up before, Dr. Prasad. She says that she was talking with someone this morning about CBD boosts, and they said that they have a CDL license, so they can drive those 40-foot container trucks, tractor trailers, and they can't take CBD because it would show up on a drug test. And her question is this true? Do you know about that?
Well, I mean, I think, it depends upon if you are measuring THC, then it will not show up. But if you are measuring any kind of a cannabinoid, THC is one, but cousin is CBD. They work on different pathway, but from this same. So sometimes in some cases, doctor recommends both.
Right.
For a short time.
Right.
And this was recommended by physicians. Sometimes combination do better job for certain things, but I don't recommend it. And so testing it is possible, but I am not sure. But at least I can assure you that it will not show THC.
Right. Okay.
It's an addictive one. But if they are measuring the overall cannabinoid system, that may show up. I don't know.
That's right. That's right. And I can comment on this because I've had clients also in this same category, and they have said that yes, it does show up on a urine test.
Yeah, so, because if he's measuring it just cannabinoid, then it will come up because THC and CBD are both cannabinoid.
And that's it. And I think, Cynthia, what the person might want to do is either get their doctor to write a prescription for it.
Right. Yeah.
Or in their case, they got to stay away from it. But they really should just go talk to the doctor, show it to the doctor, and ask the doctor to write a prescription for it. And then that may help the employer to see that it's okay. And that
because some of those guys don't know the distinction between THC and CBD.
They don't know.
Yeah.
They don't know, and they don't think the average person knows either, Dr. Prasad. So
yeah. So I'm not surprised, but I'm surprised that they will show up. But again, if this test determines just cannabinoid, then they will show up. But if it is THC specific, and that's what you should be looking for, THC specific. And THC specific will not show up because there is no way it can.
Yeah, but unfortunately, when it comes to those drug tests, obviously we have no control of it. So they revise those in some way.
Yeah.
Okay, so Alfreda has a question for us. So go ahead, Alfreda, question or comment.
Hi, Dr. Prasad and Jonathan. I have someone that's on the Zoom right now. Her mother has dementia, and you just started to talk about that. Can you talk about the benefits of the collagen boost and how that helps a person with dementia? And then I know you have written a book about it.
There is experimental data available. They have not made a human trial as yet. But what animal data shows, the animal model of Alzheimer, they have animal model of Alzheimer. They develop, and they are very nice model. And so what they found there, that the collagen peptide number 6 binds with the amyloid protein, which is the toxic one, which kills the nerve cell, and it is one of the major way you can distinguish between a dementia, Alzheimer, and dementia, like in Parkinson's dementia or vascular dementia. So the one way that we don't know in human, but at least animal data shows that the collagen peptides, if you take it, then the nerve cell makes a collagen 6 and it binds it. And when it binds it with the amyloid protein, it becomes inactive. It cannot then kill any cholinergic nerve cell, which restores your memory, and therefore you get better. And so, at least from CBD point of view, the collagen peptide, this is one data that are available, but no human trial has been made on this issue.
And then what would you recommend that a person, she said she has mild dementia, they start off taking, I know probably the EMF, the brain boost, and the collagen, those 3 things?
And probiotics.
Oh, okay.
That's it.
Okay.
Then let us know, because earlier stages of dementia can be really prevent the progression to a full-fledged dementia. And therefore, let us know how her health improves, say, in a month or 2 months when we meet like this again, because we like to know how all these combinations that you are taking it has impact on her health.
Very good. Thank you, Alfreda, for your question, Alfreda. Very good. And here's a screenshot. We encourage everyone to take a screenshot of this and go to Amazon to get Dr. Prasad's most recent book on dementia and memory loss. So it is an educational book written for the public. It provides easy to follow guidelines on how to avoid the risk of memory loss. And this book also provides recent scientific information on how to reduce the risk of memory loss and how to improve current drug treatment with the help of micronutrients. So
exactly. Also, it improved, because as you know, most of the drug that they use for Alzheimer's disease, early or late, they are what is called, their main focus is increase the level of acetylcholine. This is a molecule which stores your memory in the cell. So their main purpose is to increase the acetylcholine level by preventing the enzyme which destroy acetylcholine, or stimulate the enzyme which makes choline. So these are the kind of drug they use it. But then cholinergic neuron has to be alive so that drug can be effective.
Right.
These drug, that's why it does not last long, because the reason is dying cholinergic neuron, because you have increased oxidative stress and chronic inflammation that these drugs do not address at all. So if you combine the one which we suggested in combination with the medication that you are getting, it will prolong the effectiveness of medication for a longer period of time. This is what science says. Whether it works out, there is no clinical study on this issue, but this is what science, basic science suggests that it is possible.
That makes perfect sense. So there you have it. That's a nice little summary there, folks. But run on over there to Amazon and get that book. We got one last question here with Colleen Rivers. Colleen, if you can make it really, really quick, that would be extremely helpful right now, okay?
Surely. My question is, if my husband and I approach coaches or parents of athletes, what's some of the main benefits of the microdaily products that we need to stress?
Yes. Did you say stress? Sports?
Yeah,
Yes,
sports.
Yeah,
Mhm.
I think because when you play any sports, you breathe a lot of oxygen. And when you breathe a lot of oxygen as a byproduct, you generate a lot of free radicals. And when free radicals generate, they also cause inflammation. And so the main issue for the sports will be that if you take a in this case, microdaily EMF, say, for example, it will reduce any if free radicals are produced, they will neutralize, and chronic inflammation, they will decrease. And so those 2 points you have to emphasize, that it will reduce free radical damage, it will reduce inflammatory damage.
What about the collagen?
Yeah, collagen is for those people who are growing older, but if you're a young kid, you are playing football or soccer or whatever sports, for them, thus far, collagen peptide is not necessary because they are young, their bones are still in good shape. But as you grow older, then that becomes very important.
I know they exercise a lot, and a lot of times they're
for you
tired,
and for
so
both of you.
Yeah,
for both of you, it is important to have a collagen peptide as well as probiotics.
For both of you, but for these college kids and these professional athletes, then the focal point will be microdaily primarily. And the brain boost and the probiotics.
Before and after.
Okay.
The day they are playing. Normally, when they are in a home or anything, not playing, then you can take only twice a day.
Okay. Thank you.
Mm-hmm.
Thank you for your question, Kareen. And we did a full athletic presentation with Dr. Prasad. So you can get back with the person who invited you, and they can share that that recording with you, Kareen. Kareen, who invited you?
We're affiliates.
We're affiliates and came on our own and just had that question because I'm an ex-coach, ex-athlete, and I didn't know that there was a video about that.
Who's your sponsor?
Our sponsor is Linda
Bailey.
Linda Bailey. Okay. Yeah. Then if you can find that, then that would be good. You can direct message me if you want, and I can try to send you a link for it as well.
Thank you. Okay.
Okay. All right. So Dr. Prasad, I think we covered a mouthful here. And I think that folks were able to get a clear understanding of a number of things. The benefits of Micro Daily is just astronomical. There's no question about its benefits, and you helped us to see that clearly. And that first testimonial, which, by the way, again, the FDA has not evaluated any of these comments. This has been for information and educational purposes only. We strongly recommend that you seek the competent medical advice from professionals that you trust. Testimonials are anecdotal. What happens to one person may or may not happen to you. Okay, so just remember that. We're not trying to make any claims that Micro Daily, EMF, CBD, probiotics, any other Engaged Global products will heal, treat, or cure any disease. They are nutritional supplements only. Okay, but so we saw in that earlier testimonial, Dr. Prasad, that that Kareen claimed that her mom got so many tremendous benefits. So that stands to reason then that if I want to keep my oxidative stress down, I need to make sure that I'm taking it and putting it into my body.
Yeah.
And then on the other hand, for someone dealing with depression and anxiety, someone even asked a question in the chat, does it help with bipolar? Well, Freddie just told us she is bipolar. She just stays in the lows. So
and bipolar in young people look like a growing evidence. And it is a simple thing to try. The worst thing would be it has no effect. It has no toxicity. So you have nothing to lose to try for 90 days.
Yep, that's exactly right. Try it for 90 days and get started. You'll be amazed at and impressed with the results. Maria, are you sharing? We're 4 minutes over time. Maria, are you sharing a story, or are you asking a quick question here?
I need to ask a question.
Sure.
Now, I have two friends that have urinary tract infections, and they keep getting them. What would be a solution for that?
Well, this is a medical question, so I think, but from nutrition point of view, I would suggest that, there must be some symptoms, some other additional issues involved, an infection. And if your immune system is good, then the infection should go down. And
well, they are elders. I don't mean to interrupt.
Micro daily EMF, I would suggest for a nutrition point of view, and the probiotics, those two are still very important to have that for that kind of health conditions. And I try it. I mean, again, as I said, there is no human data available that I can tell you. And I can tell you only what might we have infection and how infection is generally treated with antibiotics or treated with the micronutrient, which stimulates your immune function, and therefore it could help in resolving the issue. So we will never know, but I would say that ask them to try for 3 months, and next month when we have meeting, or even she may see some beneficial effect in 1 month. But we like to hear from them if she has any, and if she doesn't get any benefit, don't take it.
Okay, these are men that are having
I mean,
these
sorry,
issues.
I mean, I don't know. If person is not very happy with that one, then don't take it, but try.
And they're elderly.
Yeah, because we don't know, because there is no human data available. So I can't say 100% sure this will help, but what I can say that infection occurs because your immune system is not as good. And what microdaily does is improves your immune function, and therefore it should help. And probiotics is also very important because for many reasons. And then so at least those two make a try.
EMF and probiotics.
Yes.
Gotcha. Thank you.
All right, well, very good. Thank you very much, everybody. Dr. Prasad, we can't thank you enough for your willingness to join us.
And next week I will be gone.
Yeah, and listen, folks, we'll be back with Dr. Prasad on April the 23rd. Okay, right. So put it on your calendar, folks. Dr. Prasad will be with us again April 23rd, but I'll be here next week, and we'll have Dave Namelka is going to be joining us for one of our discussions about collagen daily coming up very soon. So make sure you do not miss a Sunday, but Dr. Prasad will be back with us on April 23rd. Dr. Prasad, thank you very much. Good night, everybody.
Let's go!
Hi, Daryl.
Thank you, Dr. Prasad. Thank you.
Thanks, Jonathan. Thanks, Dr. Prasad. Pretty amazing. All righty.
Thank you very much.
Thank you, Dr. Prasad. Good night, Dr. Love you, Dr. Prasad. Let's go. Amazing. Great testimonial, Freddie. Way to go.
Thank you, Jeff.
Yeah. Hey, and it's good to see you down in South Africa there, Bernard. Way to show up.
Awesome call. Awesome call. Thank you so much, Dr. Prasad.
Bye-bye.
Yes, it was.
Let's go.
Thank you, Dr. Prasad.
Thank you, Freddie. Outstanding.
Jonathan. Anytime.
All good, Freddie.
Thank you, Daryl.
Thank you, Freddie. Good girl.
Thank you, Freddie. You can do it.
Thank you.
All right, Jeff. What's going on, Jeff?